Good afternoon, good evening. So community pharmacy, what does community pharmacy mean to you guys? Who do they serve? The community, right? The public. So this is commonly referred to as retail. So anybody that's open to the public is a community pharmacy. They service the community, the public. They're a retail pharmacy. So there's different types. We'll talk about the different types of pharmacies. Chapter 15 or 27, 26 in your other book. All right, community pharmacy. So the book quotes about 60,000 pharmacy locations nationwide. All right, so that's quite a bit. And nowadays, what are the pharmacies? What are the names of the pharmacies you see around? CVS and Walgreens. Who else? Rite Aid. Who owns Rite Aid? I think one of these guys bought them out. So they don't even kind of exist anymore, right? They're all being one of those. So these two guys kind of bought out everything. There used to be a lot more. Remember Save-Ons, Thrifties. There's a bunch of other ones. But now, you're right. It's only CVS and mostly Walgreens. If you like customers, this is the pharmacy setting with the most patient contact. If you don't like patients, work in the hospital because you're not going to be in contact with any patients at all. You're going to be working with the nursing staff. You're going to give the meds to the nurses. The nurses will give the meds to the patient. That's in the hospital. But here in retail, you're going to give the drugs directly to the patient. And that's where it can become dangerous. Because now we're giving them this stuff that can cause harm, and we're trusting them to take it safely and correctly. Right? So we gotta educate the patient by providing counseling. So in pharmacy, it's only the pharmacist that does the counseling and the drug education. So this is different from the scope of practice of an MA. So an MA can educate the patient on how to take the drug, what to look out for. But in pharmacy, it's only the pharmacist. Types of retail pharmacies. Independent. Can you guys name me an independent pharmacy? A mom and pop or a small organization? Nobody? Yeah, there's not too many of them. They usually serve special communities, special ethnic communities, but they're still around. They're the mom and pops. Who bought them all out? Yeah, so in the last 20, 25, 30 years, CVS, Walgreens bought out all the independents. Now name me a chain pharmacy. Yeah, CVS and Walgreens. So those, they have about a 99% market share of the retail pharmacies. Mass merchandiser, who also sells a bunch of stuff but might have a little pharmacy department.
Target.
Yeah, Target. But wait, which pharmacy is in Target? These guys. So Target does not run their own pharmacy anymore because they weren't making money, right? Their pharmacy was only to bring people in to buy the rest of the stuff. But they say, hey, CVS, you run it. I'll still get the customers to come in. Any other ones that used to be around that you can think of? Walmart, Costco, right? Costco has drugs. They have a pharmacy in their place still. Kmart, if there's one around, I don't know. Food stores. So do they have a pharmacy in theirs? Is it their own independent pharmacy? Because sometimes it's a Walgreens in a grocery store or a CVS. So. Government regulation. So a couple pieces of legislation that governs pharmacy. One is OBRA 90. When you hear the word budget, what do you guys think of? Money, right? So in this case, we do not want our patients to take the medication wrongly end up injuring themselves and costing us more money. In this case, the government more money. So it calls for the pharmacists to counsel federal patients. So this is a federal law, so it initially only dealt with federal patients because the government's paying their bill, right? So that means if a patient takes their medication wrong, ends up in the hospital, it's going to cost a lot more money. So if we tell them how to take their medication correctly, hopefully it's safe and they don't end up costing more money. And then DURs. DURs are drug utilization review. So we check for drug-drug interaction, drug allergy, drug disease interaction. So safety, number one concern. HIPAA. How do you spell HIPAA? How many P's, how many A's? One P, two A's, right? So two parts, portability, so you can continue your insurance. That's the continuance part. The accountability part is protected health information. You got to keep health information private and don't disclose it. Medicare Part what? Part D. So the complete name is the 2003 Medicare Prescription Drug Improvement and Modernization Act. So that's Part D. What's Part A? What does Part A cover? Medicare. So it's usually going to be inpatient. Medicare is included. Part B is usually outpatient. Part C. Part C is private. So you can elect to purchase a private plan. And then D is for drugs, right? So Medicare Part D is for drugs. So even though you have insurance, your insurance may not cover prescription drugs. So your doctor write a prescription, you're gonna have to pay for it out of pocket. So they didn't want the elderly to then spend so much money on just their medication. So they must elect a private prescription drug plan. So they have to find, or they have to pay into a private healthcare company that covers a list of drugs, right? So a list of drugs in pharmacy is called a formulary. So that means the insurance company will only cover the drugs on the formulary. Right? Have you guys ever heard this drug's not covered by your insurance company? Because it's not on the list, it's not on the formulary. So you're gonna have to know which drugs this patient can get because of their insurance, which drug that patient can get because of their insurance. It can get a little crazy. So if you're a billing expert, then you'll always find a job because the pharmacy wants to collect their money, right? And if you know how to bill, you'll collect the money for them. All right, organization of the community or retail pharmacy. So it could be laid out a little bit differently. And in the hospital, they usually have an outpatient pharmacy. So you can think of the outpatient pharmacy as well in a hospital. So transaction window. So this is where you'll have that patient contact. They'll drop off the prescription, they'll pay for meds, and then if they need counseling, who do they talk to? The pharmacist, right? So note the line starts way back there for HIPAA concern. Prescription counter. So you don't have too much space, so keep it nice and clean and neat and organized. And when you have a bunch of meds ready for check, it can actually cover the whole counter space. So just work efficiently. Definitely working with computers. You'll enter in patient info, drug info, and insurance info as well. You'll do Comm 103, where you'll have sample prescriptions. You'll enter in the patient info, doctor info, drug info, and you'll process a prescription. You'll print out labels, and then you'll go fill it. So that is Comm 103. Storage. Refrigeration. Is that cold or cool storage? Cold. If you want cool storage, that's going to be room temperature. Right? So cool is room, Cold is fridge. So that is 2 to 8 degrees Celsius. Room temperature is 15 to 30 degrees Celsius. So be careful. Don't put your food in there. Let's see. Organization of drugs. They're organized based on usually the dosage form or the route of the drug. So all the PO meds, like pills, capsules, will be in one area. But if you have something for the eyes, they'll be in one area. If it's something topical, they'll arrange it based on like dosage forms or routes. Alphabetically, usually by brand or generic name. Generic. Because the generic name for the drug is that drug, but one generic drug compound can have multiple brand names, so that means you'll have to look at multiple places. But if we put everything under the one generic name, it'll be easier to locate. So if you can't find it on the shelf, where would you check? Other storage area, maybe in the fridge. Equipment. Not going to be doing too much compounding. You might do some ointments or creams. You might mix a suspension or solution, but not too much. Compounding is mostly going to be done in a specialty pharmacy, especially compounding pharmacy. Auxiliary labels, so those are the additional warning labels. The ones they affix like may cause drowsiness, do not take with chocolate, do not take with alcohol. Prescription bins. They used to staple the patient's drugs and all that information right outside that white paper bag. So if you had good vision, you can actually read the name and read what drugs they got prescribed. So that's a big what violation? Big HIPAA violation. So that's why they put them in the hangers now, so you can't really see who it is from behind the counter. The sink, again, not going to be doing too many compounds, so it should be easy to keep clean. So this is the old way, where if you have that good vision, you can go ahead and read which drugs the patients were taking. All right, let's do some review questions. You let me know which legislation had the following requirement. So A is for OBRA 90, B, HIPAA, and C, Modernization Act, Medicare Modernization Act. Which one required, or which one is Medicare Part D? C, right? Yeah. So that's another name for it. Patient counseling. Which one required patient counseling? Hello, hello.
What's the other campus?
A, OBRA. So remember, OBRA, it was about money. So if patients don't know how to take their meds correctly, they're going to injure themselves, end up in the hospital, causing more money. So these were federal patients. So initially, it only covered federal patients. Protected health information. Which one established protected health information? Yeah, B, HIPAA, right? Health Insurance Portability and Accountability Act. DURs, Drug Utilization Review. C? Going with C? Everyone agrees? Oh, drug utilization review. Drug-drug interaction, drug-disease interaction, drug allergy. So we check that before we give them the meds so they don't end up getting injured, costing more money. Okay. Continuance of healthcare coverage. Which one? B. So good. That's portability, right? So the P. Portability. You can take your insurance from one job to the next. And lastly, private prescription drug plans. Which one required that? Yep, Medicare Part D required it. So once you reach that ripe old age, you have to buy into the program. If you don't, it's going to cost you more. So every day, how many people are eligible for Medicare every day in America? What do you think? Every day. How many reach retirement age? 10 people? 100? We got 330 million people. Of that, how many retire every day to add to this Medicare Part D?
30 million?
30? No. 10% every day? That means everyone's super old.
Every day.
This is every day.
Oh, every day.
Every day. How many people retire every day?
2,000?
Pretty close. 7,000. So that means you have 7,000 new customers every day. 7,000 new accounts you have to set up every day. 7,000 new programs, 7,000 new doctors. All right, customer service. Like I said, this is where you will have the most patient contact. So you're gonna have to be patient. And guess what? You are the last stop. So they're sick, they don't feel so good. They had to wait at the doctor's office and they have to wait to get seen. Now they come to you, they drop off their prescription. What do you tell them? Oh, have a seat. You gotta wait some more. So sometimes you get them when they're at their worst and they'll unload on you. So just stay positive. The best thing you can do. Stay positive. So be familiar with the store layout, especially if it is one of the chain stores. That's because they have their seasonal aisle or their weekly sale aisle, and that stuff changes all the time. So right now it's summer, they're getting ready for fall, so you're gonna see Halloween stuff coming soon, so they might move stuff around in those chain stores. Most of the questions you get might not be about pharmacy. On the phone, identify yourself. A lot of times nurses or doctors will call the pharmacy and they'll just start talking and they assume that you're the pharmacist. So if you pick up the phone, identify yourself. Hello, I am Technician Dang. How may I help you? They'll say, oh, you're not a pharmacist? Let me get a pharmacist right away. That way they don't have to repeat themselves, get irritated with you, and you can service them a lot better. So always identify yourself. Processing prescriptions. So this is the number one question I would ask. Got a patient coming to the counter. I'd like to fill this prescription. Have you filled a prescription here before? Right. So that's gonna eliminate a lot of questions for you. So if they say yes, what's your follow-up question? Yes, I've been here before. You're gonna ask them anything new, right? Because every year, if you're employed and you have health benefits, you might have to elect new benefits every year. So the first of the year, January 1st, you might get new account numbers, new group numbers. So just double check, especially if it's their first visit of the year. What if they answer, no, I've never been here before?
You have to provide them all that information.
Yeah, so this is going to take a lot longer. So how long would it take for a new patient to get their prescription filled? What is a reasonable time? Brand new patient to the pharmacy, brand new prescription.
An hour or two?
1 to 2 hours. So we'll see all of the stuff that needs to get checked to make that happen. What if it's a busy pharmacy? Might take a little longer, right? Waiting or pickup. Nowadays we have e-scripts, right? So that means directly from the doctor, the physician will do the order entry and it goes electronically to the pharmacy of your choice, depending on your insurance coverage. And a lot of times it's quicker, it's there waiting for you when you arrive. New patients, you'll probably have this pre-printed ready to go. Just hand this out to them, have them fill it out. And while you're processing the prescription, they can be filling out this information, and you can service them a lot quicker. It's expectation. If you educate them on the expectation, under promise, over deliver, it usually goes by a lot smoother. Because you never know. There might be a hiccup. The prescription might get rejected by the insurance company. Things to check. Prescription information, correct drug, definitely, correct strength. If it is a scheduled drug, so C1 through C5, narcotic drugs, painkillers, things like that, then you got to make sure there is a legitimate DEA number. And we'll learn how to verify a DEA number. Third-party billing, who's paying the balance? Right? Patient usually pays a copay, right? $10 for generic, $20 for brand. The rest of the cost of the drugs is picked up by the insurance company. What does Cigna stand for? SIG codes. What are SIG codes? Cigna are directions. So SIG codes is just short for direction codes. Quantity, usually it's followed by a pound sign to let you know. Refills, refills will depend on the scheduled drugs. If it's RX only, you usually get up to a year's worth of refills. But if it's a scheduled drug 1 through 5, it'll be limited. Online billing. So the processing of claims electronically is called adjudication. So ask for the patient's insurance card, and on it it'll have pretty good information for you. Here it has primary care physician, copay of 20, pharmacy, so drug coverage is 50%. So you know right away their copay and their share of the drug. Plan and group number. So if your company negotiates every year for better health coverage, then they're going to change that group number every year. The plan number might stay the same because it's through the same company, but the details might change, so the group number might change. Your patient ID number, will that change a lot? Nah, usually not. DAW, dispense as written. So what's more expensive, brand or generic? More expensive. Brand, definitely. So if a patient really wants the brand, then we got to let the insurance company know that it's the patient that wants the brand, right? We'd give them generic, but the patient insists on the brand, so that's why we're charging a little bit higher. So as long as we justify it to the insurance company, they might just pay for it. Patient code, that's how they relate to the card holder. So whoever has the job, whoever's employed, they're the card holder, they have the benefits, and if they cover their spouse or dependents, then they'll have a different code. All right, refills. So I alluded to the limits on refills. So we'll finish up this slide and then we'll take a quick break. So refills. So if a patient asks for refills, you can look it up a couple ways. You can look it up by the prescription number or by the patient's profile. So just ask for the last name, first name, date of birth, just to double check. And then you can pull up all their drugs in the system, or easier, just jot down the prescription number. If there's no refills left, can you give them another one without them seeing the doctor? Do they have to see the doctor before?
No, it should say on the thing, right?
So if you have no more refills, we can actually request a refill before the patient has a chance to see the doctor. Right? So that happens a lot. So if there's no more refills, we can always send that request. Right? And the technician can also take the confirmation from the doctor or any representative from the physician's office. So a refill authorization, nothing's changing. Same drug, same direction, same strength, same patient. So if the doctor authorizes it, the tech can go ahead and take that. New prescriptions, a technician cannot take a new verbal order over the Refill too soon, refill too late. So we're going to learn EDS. That stands for estimated days supply. So if I give you a bunch of drugs, how long should that last you, right? So if I give you 10 pills, one a day, how long should that last you? 10 days, right? One pill, or 10 pills, one a day, that should be 10 days. But if you came back in 5 days, what happened? Yeah, refill too soon, which would indicate you're taking it too much. What if you came back next month? Refill too late. You're not taking enough of the medication. So that would be rejected. Those prescriptions that are trying to refill too soon or too late, the insurance company is going to say, hey, what's going on here? It might get rejected. You just got to call up the insurance company and let them know what's going on. So if it is non-controlled, prescription only, RX only, then you have up to a year to fill that prescription. It's only when they're scheduled drugs that refill changes. So C2, 0 refills. So for example, morphine, no refills. ADD meds, right? You got to have a prescription every month for Adderall. C3, 4, and 5. So all 3 of these, you get 5 refills within 6 months. So you get your initial fill plus 1, 2, 3, 4, 5 more for a total of 6. So 6 fills within 6 months. So half a year's worth. RX only, year expiration. Safety, we'll do our drug-drug interaction warning. So when you enter it in, right, any drug that's in the patient's profile or current drugs they're taking, any supplements, vitamins, minerals, herbs, it'll do a check and it'll pop up a warning if there is. Make sure you notify the pharmacist. They will okay the override. All right, OBRA. What does OBRA stand for? Omnibus Budget Reconciliation Act, right? So OBRA 90. Specify the year. What is PHI? Protected Health Information. Very good. DEA? Agency or administration? We'll take either. DAW? I want brand. I want generic. Dispense as written. So the doctor may specify a brand, may specify a generic, not just only the patient. OTC. What's BTC then? Behind the counter. Do you need a prescription for over the counter? How about behind the counter? Do you need a prescription? No, you don't need a prescription. We'll go over the differences. And lastly, HIPAA.
Health Insurance Portability Accountable Act.
Yep, Health Insurance Portability and Accountability Act. What is controlled refrigerator temperature?
It's temperature for medication.
What is it? What is the number? Is it cold or cool? Cold. So what degree is it?
32 or below.
2 to 8. 2 to 8 degrees Celsius.
What's that in Fahrenheit?
I don't know. Off the top of my head. Room temperature, is that cold or cool?
Cold.
Cool.
Or cool.
This is cold. Right. So this is 15 to 30, which is 59 to 86 degrees Fahrenheit. I forgot this skips my head right now. A C3 prescription can have how many refills? C3.
Was that the 5, 6?
Yeah, so you can have 5 within 6 months. So C3, 4, and 5, all those categories. Can a technician take a refill authorization over the phone? A verbal order over the phone. Technician.
No.
Refill. Anything changing on a refill? Is it the same drug? Same strength, same patient, same directions. What can go wrong? So refills, yes. Right? Technicians cannot take new prescriptions because what can go wrong in a new prescription? Is it the right drug? I think it was. Is it the right strength? I heard something. Was it the right patient? I guess. Right? So if it's a new script, technicians cannot. But if it's a refill, yeah, pretty bad if you go wrong with that one. I'll help you out. All right, preparing the prescription. So we got the prescription to the pharmacy. Then we'll need to check it. Then we got to enter in the information. So patient information, prescription information, and then we also enter in the insurance information. So if they are just a cash payer, so sometimes private or cash, that just means you don't have to go through insurance. So you can just skip entering the insurance company if they're just a private payer. If they're not, you have to bill the insurance, do the adjudication. Triple check system, same as an MA. So you'll need to check the drug label when you pull the medication. So that's your first check. Your second check is when you prep the medication. And in pharmacy, it's when we restock. You'll need to check the label to put it back in the right place. So in medicine, it was right before you administer the drug, you check the label once again. So it's very similar. So on the prescription label, it'll have a 10-digit number called the NDC. The NDC stands for National Drug Code. If you match up the National Drug Code from the prescription label with the bottle, then you know you filled the correct drug every single time. Those 10 digits match, you're good to go. So the NDC number is made up of 3 parts. So the first part tells you who is the manufacturer. Right? Yeah.
So the National Drug Code is the number on the top right there, right?
The top, this one?
What would that be?
I think that's their phone number.
Just the number? Okay.
This is the prescription number.
But you said it has to be 10 numbers, right?
10 digits, yeah.
10 digits.
This one doesn't have it. This is an older format label. But it'll be printed right on this label, just matched up with the one that's on the bottom. So 10 digits. First set of digits lets you know who's the manufacturer. The second set of digits is the drug code or the product code. So I'll let you know from the manufacturer which drug it is. And the third set of digits is the package size. So if it comes 100 tablets or 500 tablets per bottle, there'll be a unique code for that. Counting trays, we use a spatula and we count by 5s. Right? 5, 10, 15, 20. So that's the most efficient way in pharmacy. Select the correct container. So we are repackaging. Right? We're taking it from the manufacturer's big old bulk stock bottle and we're pouring the bottles into a little container for the patient to take home. So there's an expiration date on the stock bottle. That's if the drug stays in the stock bottle at room temperature, it's good up to that expiration date. But we are repackaging into these smaller containers, so the most you can give it is 1 year from repackaging. So even though the stock bottle might be good for 2-3 years, you're repackaging, so you can only guarantee stability for a year after repackaging. Safety caps. So the Poison Prevention Act required all drugs to be placed in safety caps, except for some exempt drugs like nitroglycerin, sublingual. So if you're having a heart attack, we don't want you to have trouble opening your medication. If there's no children, The patient can request no safety caps for their home, or if they have problems with their hand strength, they request easy open caps as well. Select the correct size, not too big, not too small, and depending on the dosage form, you might put ointments in jars, liquid medications like suspensions and solutions in the amber bottles. So why are these bottles amber?
Because the light.
Yeah.
The light will affect it. It's what do you call it? There's potential to help the patient.
Yeah. So UV light will react with certain compounds, so that brownish reddish color will help filter out UV and will prevent the drug from degrading or changing over time. Automation. So if your drug is not on the shelf, it might be in the fast mover areas. So of the top 100, there's probably about 25 that every pharmacy will order all the time. Drugs like Vicodin, ibuprofen 800. Labels, prescriptions, yeah, there are machines that will actually label the bottle, fill the med, cap the med, and package it ready for you to just check. Auxiliary labels, here are some examples. Take with food. Some is take without food. Take on an empty stomach. Give me an example of a drug you want to take with food that might upset your stomach, so they say take with food. Aspirin. Antibiotics, you usually want to take it without food, especially if it is tetracycline. You don't want any dairy products because they'll bind with the antibiotics and doesn't make it active anymore. And it slows absorption for antibiotics. Aspirin is an acid, so if you put acid in your stomach, it might upset it. So you can take that with a little food. May cause drowsiness, impair your ability to drive, external use only. Right, so avoid sunlight. Name me a drug where it will cause photosensitivity. You'll get a rash easy. Antibiotics is one. Right, tetracycline, stay out of the sun. And some diuretics. So water pills, some water pills, you have to stay out of the sun as well. So as you get more familiar with the drugs, it'll be easier for you to pick which ones, and the pharmacist will help you out if you're unsure. Final check and staging. You will need the original hard copy, right? You will have the label there. You will also have a second label. If this is the first prescription, you'll always print a second label. So you'll put that on the back of the hard copy. You have the stock bottle, and then you have what's taking home, what the patient's taking home. So the pharmacist will check the hard copy versus what you process on the prescription. There's about 30 things that they'll need to look over, making sure it's accurate. They'll check it against the stock bottle and what you filled. Right? So you're going to have it staged for the pharmacist to check efficiently. For new prescriptions, the second label is affixed to the back because once the bottle goes home with the patient, the label's out of our hands. So we want a second label that represent what the patient took home. So if there's any problems, errors that we made, we know we have a represented second label. We fix that on the back side. And we will fill our prescriptions based on the RX number, just numerically by the RX number. We got to file, however, our controlled substances differently. We put a red C here, 1 inch from the upper right-hand corner, and then we just file our controlled substances different from non-controlled drugs. So it's checked, we package it, the patient comes up. Can they send somebody else to pick up their meds? Okay, what do you have to check? Yeah, so they can send any representative to pick up their meds. So you just have to make your judgment call on it, because You can even send your friends to pick up your narcotics, your controlled meds. So maintain HIPAA, so the line starts a few feet back. They no longer have your names and your drugs exposed for everyone to see. Audits, signature logs. So patient pickup or their representative when they pick up, show ID, sign for it. But more importantly, documentation that we offered counseling. Who can offer counseling? Who can offer it? Everybody. Hey, would you like counseling on your medication? Anybody can say that to the patient. But who can conduct it? The pharmacist. So we offered it. If they say no, we're going to say patient decline. And we say, hey, can you sign that you decline? That way, that covers our butt. Because if they go home, take their meds, and they say, hey, they never went over it with me, and I got injured, I'm going to sue you, and they signed right here, you didn't want us to go over the meds with you. You signed right here, right? That's to cover your butt. Do you guys know who CMS is? Center for Medicare and Medicaid Services. So they're a bulk of business. About 80% of your business, because it's mostly elderly patient that will come in and pick up meds. So Medicare, Medicaid services, make sure that you're doing everything you said you are, you're treating everyone the same, and you're not causing any fraudulent transactions. Hard copies, filing. So by prescription number, just remember that controlled substance, you got to file them separately. Put that little red C 1 inch. Is this compliant? Is that pickup log compliant? Why not? Why isn't it HIPAA compliant? You can't show these previous names. You have to put a card over it and cover, and only leave the next space visible. Because if I look at the list, I know who your patients are, right? So just make sure you cover up the previous signatures. Cash register. Nowadays, it's pretty easy. Credit, debit. Things that might be hard is like stores that have gift cards still. Just know that even though you're working in pharmacy, you may have to run the register. And if it's busy, then you might have to run the register even for non-pharmacy purchases. All right. Categories of drugs. So we have prescription only, you guys are familiar with. RX only. We have some controlled meds, right? C1, then we have C2, C3 through 5. C1. Can you get a prescription for C1 med? So currently C1 is no acceptable medical use. C2, no refills. C3, 4, and 5, that's the 5 refills within 6 months. RX only, unlimited refills, usually up to a year. Over the counter, no prescription required. The only thing is you need to be screened by a pharmacist or a pharmacy technician, usually for safety and or documentation. So for example, Sudafed, you guys heard of Sudafed? They use that to manufacture methamphetamine, so we want to prevent that from happening. So we'll record, and there are limits to the amount of Sudafed you can get. So that is behind the counter. You don't need a prescription, but we want to check safety and or limits. Plan B, that is the emergency contraceptives. It's so safe that since 2015, it's pretty much over the counter. There's really not too much of a check nowadays. Insulin, so if you're diabetic and you run out of insulin, do you have time to see your doctor, get a prescription, come back and get it filled before you die? Probably not, right? So just show them your empty vials, your previous prescription labels, and they should be able to dispense you a bottle of insulin. Depending on where you're at, dextromethorphan, that's the cough suppressant. In high doses, it's abused. So some places you have to put it behind the counter. Do you need a prescription? No, right? Sometimes you can get small quantities of narcotics, Schedule 5 drugs, over the counter as well. Yeah.
Does this vary state to state? Because like in Florida, quercetin is out on the floor or it's behind counter, like you have to have a
Yeah.
prescription for it, but here it's like just in any store.
Yeah, Florida, because of abuse, they have more stringent. So there's more chemicals and compounds that they have to keep behind the counter. So if any laws differ, go with the most stringent of the law. So good thing is any certification exams, they only go with the national standard. So they don't deal with state or local. Just stick with the national standard if you're taking the national exam. Pharmacies can also dispense not medication but medical equipment. So if you get a prescription for a wheelchair, who pays for it? If you get a prescription for a hospital bed for in-home use, who pays for it? Exactly. The prescription shows that there is a medical need for that equipment. Right? And what do you think the cost is for a medical wheelchair?
Thousands.
Yeah, at least a few $100s, because if it's for medical use, it has to be passed and certified, and that's what makes it cost so much. What is it, $250 IV pool? It's all stainless steel, nothing special. But since it's medical, has to pass certifications. Other duties. So in the pharmacy, you'll usually have one person, that's the purchaser or the pharmacy buyer. Very prestigious position. They have control of a lot of things in the pharmacy. So ordering, that's everyone's responsibility. You can do them by hand, writing down a list. You can do it by card system, or these days, just scan and then push on the scanner how much you want to reorder. Can a technician sign for controlled substances? Yeah, you can. However, once you sign for it, you're going to be responsible. So if you do, check everything. Open every box, open every vial, make sure it's all there. Make sure that nothing's broken, cracked, and leaking, because you don't have to accept it. As long as you look at it with the delivery personnel right then and there, mark it on the packing slip, you don't have to take delivery if it's broken or damaged. Okay? Open every packaging. Even from the manufacturer, it might have missing count. So even if it's sealed, open it up because it's your name. Stickers and shelving. So when you get your product in, they'll send you your invoice and they'll send you also a bunch of stickers and labels. So you can peel those off and affix those to every item. That makes it easy for you to price tag everything. And if you guys know how to read the code, you can actually figure out the price. So there's a cost and then there's a price that they charge on it. And the code is brush cleaned. So those letters represent numbers. 0, 1, 2, 3, 4, 5, 6, 7, 8, 9. So now you guys can read the code. You'll know what they paid for it. So now you can offer them, hey, I'll give you $1 for this, because they only paid 38 cents, right? If you read the code. It's on those little stickers that they fix on there. Additional services from pharmacies. So expensive, maybe time consuming to get an appointment to see a doctor. But at a minute clinic, you can see a registered nurse or a nurse practitioner for a fraction of the cost, quicker, and most insurance will cover it now because it is cheaper than seeing the doctor. For example, a sports physical. So you can get a sports physical from your doctor, like your kid's gonna play football. They'll need to pass a physical. You can set up an appointment with your doctor, see your doctor, pay your doctor, or quickly go to Minute Clinic, get seen by a nurse practitioner, same exact thing, and it's probably a lot cheaper for the insurance company and you overall as well. So that's one service. Other is disease states, like diabetes. So we want to control their like A1C levels. So we want to come in, get blood work checked. COPD and asthma clinics. So do therapy as well. Anticoagulant. So this used to be done in the hospital. You guys heard of warfarin or Coumadin?
So in the blood.
Yeah, blood thinner, right? So if you have had a heart attack or susceptible to blood clots, they'll give you a blood thinner, but if they give you too much, you're gonna bleed, right? You're gonna bleed, right? And if they don't give you enough, then you might get a blood clot. So you gotta go in, get your blood levels checked. Sometimes it's 3 times a week, sometimes it's twice a week. But here, the pharmacy is in your neighborhood, in your area, more convenient for you. And most likely, probably less costly than hospital prices. Vaccines. Do you need a sign of consent? Yeah. So a vaccine, you need a consent. That means somebody has to give it, informed consent, and somebody has to evaluate you and state that you need this vaccine. So a nurse practitioner, or in some cases a pharmacist with training can actually evaluate you, write a prescription, and then administer vaccines as well. All right, some more abbreviations. What is an NDC?
Data center.
National
National.
Drug Code, right?
Drug code, there you
How
go.
many digits? 10 digits. Very good. DXM. Cough suppressant. High doses, it's abused. So Robitussin DM contains the cough suppressant dextromethorphan. NSC.
National.
So if it's not a safety cap, then it is a non-safety cap or easy cap. POS. The register. Get your head out the gutter. Point of sales. So that's your register. DMEs, walkers, wheelchairs, IV poles. What are they? Durable,
Machine.
medical. Wait, remember, if there's a prescription for it, the insurance company will pay for it. You guys know what asthma is, but what does COPD stand for?
Chronic something, pulmonary something.
Chronic obstructive pulmonary disease.
Yeah.
Not too bad. So get familiar with those abbreviations. You'll use those quite a bit. All right, last set of review questions. And then, since you guys have more, 1, 2, 3, 4, 5, 7, you guys get to do 3 each now instead of 5 each. So thank you guys for coming in. What are the purposes of signature logs?
Accountability.
Accountability, very good. Who? CMS, and also for offer of counseling, right? Sometimes the HIPAA acknowledgement as well. So very good. How are hard copies for controlled substances filed?
Computer.
Hard copy, the originals. What do you have to do?
Other originals. Stamp it
Where?
on the front.
What location on the front?
Top right.
And then top right, very good. So a red C, 1 inch from the upper right. C2s must be filed separately. So if the DA comes in, they just want to look at the C2s. Everything else, you can file them together. All right, so that was retail pharmacy in a nutshell. So let's go ahead and go on to today's homework. So I'll assign you guys the problems on the board.